So welcome everybody to this second session of the IHE-Europe experience. My name is Andreas Klingler and I will be moderating this session. This session is a little bit special. It's about the national initiatives and about getting to know each other which are active in these national initiatives, exchange experience and share tips and tricks. It will be hosted by Karlien Erauw, who is vendor co-chair of IHE Belgium. So handing over to you, Karlien. And forgot to mention, if you have questions, you can either type them into chat, or since this is supposed to be a more interactive session, you can then just chime in.
Good morning and welcome to you all. The second session of the IHE-Europe experience days that is happening during the online Connectathon week. Welcome. As said by Andreas, this will be an interactive session. So I hope that you are ready for it, that you know what you registered for. So what is a national initiative? The national initiative is the organization in a country. IHE Belgium, IHE Netherlands. So IHE Europe counts national initiatives in Austria, Switzerland, Italy, Turkey, Czechia, Finland, Germany, Belgium, Luxembourg, and the Netherlands, Spain, France, and the UK. If you go to that URL, you can find all about it. And you can also go to the links. In order to start engaging you, I have a question for you, because it would be good to know who you are. So you can go through your browser just by using this URL, or you can scan the codes and on your mobile and go there. And there we have a question to know whether you are active within your national initiative. So you can speak up if you want. You can unmute yourself as it's an interactive session. You are supposed to be able to talk. So don't hesitate to unmute and to speak up if you have a question on this poll. So I see the answers coming in. Thank you for that. So please let us know in the chat or in the through your microphone whether you have issues. So we are here with more than 20 people. I do await your answers, so please scan the code. So let's see where you are. Someone says, no, I don't know that it exists. No, I'm not active, but it exists. My organization is a member and you're active as a co-chair. So I think it's great that we have a diverse audience here. I've also looked into the people that were registered. We have people from several countries, so that is diverse as well. So I hope it will be, we can have a great session today. So as you've seen, there are plenty of national initiatives within Europe, but they are very different as well. Some of them are incorporated in organizations, national organizations. Some are separate organizations, some are working together in the same organization as the HL7 national initiative. I hope you all know HL7. It's a similar standards development organization as IHE, but HL7 is more developing standards, and IHE is using standards to incorporate them into IHE profiles. I would like to point out a little bit the different levels of a national initiative. IHE-Europe was established in 1997. It's more than 20 years ago. IHE Netherlands immediately followed the initiative and was established in 98. So they have celebrated their 20 years as well. If you compare this with Belgium, Belgium is very young. We only exist since really the end of 2016, at the end of December. We are still a very limited community. We do have a lot of university hospitals and also some vendors as well, the big ones and some small ones as well. IHE Netherlands community is very extended. They have plenty of vendors. They are really present within the ecosystem in the Netherlands with all of the different organizations. And in the Netherlands, you have a lot of organizations. They work closely with HL7 Netherlands. They work closely with, they have their standaardenorganisatie with NICTIS, their experience center, and they run extended joint projects since years. If you look at the infrastructure in Belgium, the e-health infrastructure in Belgium and in the Netherlands, it's a little bit different as well. Whereas in Belgium, we do have a fixed infrastructure with our hubs and our Volt system where they are connected. In the Netherlands, it's more a regional one based on IHE XDS. Where they encounter different issues as in Belgium. And for example, to the exchange of medical images, the challenges are completely different. The governance of both national initiatives are very different as well. In Belgium, we've also established HL7 Belgium last year, which exists in the Netherlands since several years as well, but it's completely different from IHE. And on top, you can check out both websites. They're completely at a different level as well, whereas we only have one page with a couple of items. We can only congratulate IHE Netherlands with their very nice, completely refurbished website, which has all of the informations. So this is how, to give you an example of the different levels. And the goal here is as well how exchange information with you guys. What are the needs? What are your needs? Do you have any tips for us on these things? So the national initiatives are, of course, working on projects at national level by using the IHE profiles. As we all know, it's kind of the 80-20 principle where you can use standards and profiles for 80% of your use case that you want to solve, but you need some tweaking for the remaining 20%. Here you see some projects in Switzerland. They are running projectathons since years on the electronic patient record, and recently they have started their project on e-medication. In the Netherlands, you have plenty of documents. I don't feel that I'm the right person to go over to go in it, but they are having plenty of activities and running plenty of projects. Greece started there to work on an interoperability framework. They also work together with HL7 Greece, and they will be running a projectathon early July, which is open for everyone and free. So if you're a vendor here, don't hesitate to reach out to us. There is a session dedicated today or in the upcoming days on it as well. So feel free to explore it and to participate. In Belgium, recently, our focus is more on the HL7 fire standard due to the reference in the e-health roadmap. So we are working a lot on fire within our same group of IHE and HL7 Belgium. Because the stakeholders are very much the same, we've decided to incorporate it. My question here to you is, who is involved in a national project, and who wants to tell us something more about one of his national projects?
Well, I can start about Switzerland.
Yes, please go ahead, Stefan.
So Stefan Spani, well, user co-chair of IHE-Europe, but I am also at the board of IHE Switzerland and representative of IHE Switzerland. In Switzerland, we have a law since 2017 for establishing the electronic patient record, with normally operational due date April 2020. In reality, it will be between 21 and 22. The whole infrastructure is XDS based, so strongly based on IHE profiles. And in order to enable the different software providers to test their implementation, because we have several implementations in Switzerland, we have set up a global environment, testing environment, based on Gazelle tools, of course. And the federal government is running a project-a-thon every year for enabling the stakeholders to test, validate their solution. There is also a formal certification by an auditor that is performed in order to be able to go live. So we now had, I think, 4 project-a-thons already, and 2 project-a-thons on e-medication, because we are starting an extension of the electronic patient record for providing a service for managing a shared medication treatment plan. It's being developed, and it will be a pilot in one region. But we already started to include the testing with the Gazelle tools for those who want to be in the pilot. So we had a specific e-medication project-a-thon, but now it's included in the yearly national project-a-thon.
And I think your specifications, summary and detailed specifications are available online in English, right?
Yes, for a certain number of things. You mean for the e-medication?
Yes, for the e-medication.
For the e-medication, there is a national concept that has been proposed, which is freely available indeed. It was written in English because it's the common language between the different regions of Switzerland. And it's freely available on the website of eHealth Suisse, not of IHE, but eHealth Suisse is the federal entity formed by cantons and federal government, and piloting the setup and the running of the electronic patient record testing platform. Technical specifications are not yet complete. They are almost complete, but we are completing them while developing the system, because it's also the way to identify what we have to specify. But specifications are also in English and will be available freely.
Yeah, I think that's great, because in Belgium, we're also looking into e-medication, and through the links of having a Belgian guy present in the IHE pharmacy working groups, it came to us.
We are working together.
Yeah, indeed. And because for people that don't know, IHE, IHE International, IHE Europe has working groups, and that you can join if you are present in a national initiative. And then really you can work on new profiles or identify gaps that are there. So these communities are completely open. Thank you, Stefan, for sharing this.
Just a precision regarding joining
the
committee,
IHE,
the IHE Pharmacy or any of these committees. You have to be member of IHE International in order to be a full member of such a committee.
Yeah, but if you're active in your IHE Europe national initiative,
you may join as an invitee, not as a full member.
Ah, okay.
You have no voting right if you are not member of IHE International. That's the rule for every deployment committee.
Okay, good to know.
Yeah. Development committee.
And then in the Netherlands, a lot is happening. Does anyone feel?
I can explain a little bit.
Yeah, I can also explain for Evert.
So maybe let's go first to Evert, and then Piet can more elaborate a little bit on the way you are running projectathons like that. Evert, thank you for speaking up.
Evert Sanders, I'm user chair of IHE Netherlands. Miss my, okay. Well, in the Netherlands, well, there are, I have to divide it a little bit. Of course, we have the image. I'm a radiologist, so I'm interested in image and report, the report of the image exchange. That's a large project that's called TWIN, TWIIN. The TWIN project is in fact based on XDS, and behind he can explain it more in detail. Because of COVID, we made a small step in between because patients went from the south to the north of the Netherlands during the COVID 1 year ago, and the government realized that it was impossible in practice to exchange the information of that patient to the north of the Netherlands. So they started a project to, well, electronically use CD-ROM exchange to give the hospital in the north of the Netherlands the possibility to have information about that COVID patient. That's a TWIN. Well, that's TWIN. Piet, he can explain more about it. We have some other projects. TWIN is based on XDS, so that's IHE. So as a radiologist, I'm happy, but there are a lot of problems to get it in fully running. There are other projects, and one of them is well, exchange of summaries of the patient health records, so that you have, in fact, you have a split. You have the large firms like Epic, Cerner, and in the Netherlands, Chipsoft, and the patient health record systems. Those information will be exchanged as a summary, and that's, well, has a long history. Is based on CCD. For exchange, there's discussion how to do it. XDS can play a role. Then you have a large project that's called Baby Connect. It's about exchanging the information of the mother and birth between, well, inside regions. And they want to scale it up towards a countrywide exchange. In general, the government is now more active because also of COVID, but also some other reasons. They are preparing a law like Switzerland and the law says, or it's nearly finished, the law, that every that as hospitals we have to exchange the information electronically between each other. The difficulty is, of course, how to exchange. You can exchange, but if the other party can't read it, by law you're correct, but nobody. If nobody can read it, you haven't reached anything. Medication has a long history. It's a separate infrastructure called AORTA. So that in the Netherlands there are a lot of different initiatives. Government plays a role in it, and one of the reasons of what we as IHE Netherlands explain to the hospital, to the government, is please keep things that don't look at it as separate initiatives. They have to come together. And that's also one of the reasons why IHE exists. If everybody makes its own solution, we haven't reached anything. So, and then there is another initiatives about patient involvement. It's called Met Mij. Tomorrow there's a presentation about it these days. And perhaps Piet Hein, you can explain more about Twin projects, perhaps?
Yeah, that's great, Evert. Yeah, to explain a little.
Maybe Piet, I think it might be useful to explain what your organization is doing as well, because this is something that I'm a little bit jealous about. In the Netherlands, you have Medical Fit, your organization that is active in the ecosystem as well, and it is really working together to solve the interoperability issues and to test them.
Okay, yeah. Karlien, thank you very much for that introduction. We are an independent consultancy firm, and we help in a lot of national programs to realize interoperability. And we do that also with IHE tooling from IHE services. So we have set up for the national exchange of what Evert mentioned, AORTA. That's an organization from all hospitals in the Netherlands and professionals to exchange medical records, to exchange images now between hospitals. And we provide that organization with an online tooling set based on IHE Gazelle. And we have also combined it with some FHIR extensions. And what we're now doing, we are helping testing the exchange of medical records. That's based on what Evert called the CCD, this continuity of care documents. And we are just last week started about acute exchange of information. So if for a trauma, for example, how you can combine the data from an ambulance to an hospital. And we are now starting to help that organization to get those records also, I would say verified, tested with different vendors. What Evert also called the Twin, that's that's the project to get a second infrastructure besides the already national exchange of, I would say, more easy medical summaries between primary care and hospitals, and that will be also combined with regional exchanges, and that's what we call the project Connect. and that's one of the initiatives, and is also funded by the hospitals and the insurance companies in the Netherlands. And we also started to help testing in exchange of medical records between patients and the national exchange point. It's LSP called. It's that mentioned aorta infrastructure. So yeah, we try to get vendors and also the professionals like hospitals to get them on the same level, and that we can help them in the semantic and also in the syntax exchange. And we do that also for national screening programs. We have a quality registry for pre-birth registration and also pre-birth screening. We also help there the national registration for that. And we do also the screening for breast cancer, and that is mainly colon screening, which we support. But that's in summary what we do, but we use the existing IHE tooling with some extensions we have developed together with our clients.
Thank you, Piet-Hein. So for people who are not familiar with the IHE terms, I have a connectathon and a projectathon. A connectathon is where vendors are testing against IHE profiles. And if they successfully test with 3 vendors, they get an integration statement. Projectathons is where the stakeholders of the project test the project. Ideally, the project specification does reference IHE profiles or other standards. So, but in a projectathon, you test against a project specification. So I think we have some new people here as well, or from countries that I am not familiar with. We have Maria. I think you're from Cyprus. What is your priority for the moment? What kind of information are you looking for? Why your interest in IHE? If you are willing to speak, please unmute. Or Maria, can you hear us? We also have Mrs. Caschini from Italy. Do you want to raise something about what is happening currently in Italy?
Hi, thank you. But indeed, I'm not so informed about this, because I know that IHE exists in Italy, but I don't have the possibility, I didn't have the opportunity to follow closely what are the developments. So it would be a pleasure in the future.
But Fidelia, and what current issue, for example, are you facing currently in exchanging health data? It's always good to know what people are facing, and each country it's different.
Yes, we are facing different issues, for instance, concerning interoperability problems about the codes. I mean, in Italy, we prefer open codes, available standards, free standards, and not always is possible in different healthcare organizations to approach these solutions. And now we are trying to create an ecosystem where it's possible to exchange all the information with private and public hospitals using the same standards. But even if the Ministry of Health is working to use the same codes for sure, because we have in Italy a national health system, which is a public based system for healthcare. However, we have different healthcare organizations which are differently organized, and maybe private organizations which want to be advanced in using, for instance, softwares for imaging or for labs data exchanges, and we are working in this direction, but it's everything must be built. Okay, so the work is in progress.
Okay, thank you, Fidelia, for pointing this out. So before we continue, I have another poll for you. What can IHE-Europe do more for you? And please be selfish here. Just, and you can input more answers at this time. Is the can you see the questions? What should be IHE-Europe's priority? Please go and click.
About statistics, there's not a lot of...
I only see one reply.
Yeah.
Okay, maybe it was my network. It's a little bit slow. You can indicate more options. For example, I see here on the second question, exchange experience on governance of national initiatives. I think T has a lot of experience with the governance of IHE Netherlands, how you work with different organizations. But T, I know you can talk hours on this. Could you explain it for a couple of minutes? The way IHE Netherlands is working with his stakeholders and how you can really push forward the IHE spirit and mission?
Yeah, I will do. For those who don't know me, I'm the vendor co-chair of IHE the Netherlands. And I put a lot of effort in getting involved in the higher layers of the multi-level model of interoperability. So looking at the government, I'm looking at the Ministry of Health, but also to the Ministry of Economic Affairs for the vendor part. Starting with the Ministry of Health, we are involved in an expert group on standardization. The Ministry of Health also has a vendor manager, and the vendor manager has a regular meeting with the vendor managers of the several subsidized national projects. I'm also in that meetings of the Ministry of Health. First of all, I was connected from the national program Baby Connect. I'm advisor for the board. But now I'm asked to take part in that meeting from my role of IHE, vendor co-chair. So it's nice to sit there and have a good conversation. In the Netherlands, we also have a national SDO meeting. So on a board level, we discuss with the different standards, the developing organizations, all strategic topics, how to cooperate, how to share things, or to collaborate, to have more collaboration. When I look to economic affairs, there's now a movement. It's called Task Force, in Dutch, Samen vooruit, Together Forward. And that's a reaction on that the Secretary General of the Ministry of Health told to the market, we set the guidelines, the borders, but you have to do it. And there was actually no coordination how to do it. So the economic affairs started this movement. And there are quite some vendors who joined. I helped to prepare the first session. And it's also financed by the Ministry of Health. They are now struggling a little bit to stay connected with the health. And I will advise them on that. And there's a thing on the National Healthcare Institute. That's an organization that does advisory and implementing on the healthcare insurance domain. And they are also responsible for the quality standards for the healthcare professionals. So this is an important link to the healthcare, to the users, to the healthcare professionals. And they are coming up with an important addition. They are now going to ask for the quality standards that you can apply to a healthcare process, an information paragraph. And actually, there they will ask a healthcare professional to make explicit 3 layers. It's policy, process, and information layer. So I think it will help enormously if this will happen in all the countries, because it's based on the multi-level model of IHE. So they understand our approach. So I help them in that, and I connect the National Healthcare Institute with real projects who are also using IHE to learn both for the policy side and both that the national project knows what is coming and how to react. Then the last one, I'm talking with the Dutch Healthcare Authority. That's an autonomous administrative authority. It's part of the Dutch Ministry of Health. And they are now working on network care or connected care and thinking about what should they change in financial terms to facilitate network care. So I think that's also an opportunity for IHE. So that are some bodies in which we are positioned, I think, well. We work well with NICTIS. For sure now Esther skipped to NICTIS.
But I have a question for you.
Yeah.
You work well with all these organizations, but you exist since more than 20 years. In the beginning, if you remember, how did the door open? Did it happen immediately? If you can elaborate very shortly, did you start with writing 2-pagers, notes? No. How did you open the door?
Yeah, I think it's important to know my past. I worked at the Association of Medical Specialists as National Program Manager, IT on Innovation. So I know the Association of the Medical Specialists. I worked at the Ministry of Health on IT in healthcare. and I worked a lot with NICTIS. So I already knew all the
stakeholders,
the important stakeholders of these bodies. I did it right, but I sat down on a table, mostly informal, and told them my story. And that's it. And I think it's important to tell, hey, I want to talk to you, or I want to connect you with these stakeholders. Hey, but it's informal. So I won't pick you, hey, you told that on that table and then you have to do it. No, it's informal. We are just brainstorming. And then the movement is starting. They got inspired.
I think this is an important takeaway. Yeah? I try to convince people of the value and not trying to sell and working on trust. Thank you very much, T, for that exchange.
But Karlien, it's a role for IHE-Europe. We need to, and we discussed it in IHE Netherlands also, we need to explain the role of IHE. And that's not only that we have solutions called profiles. There's another important message. We have a methodology to solve problems. And we use standards, but we use them in a coordinated way. Those kinds of things are important for the decision makers. And also one other thing, they always thought we were as well a vendor organization. So we have to really emphasize that we are a community. Those elements are important.
Yes, indeed. You touch a good point here. Indeed, IHE-Europe is a vendor and a users community. And the very basic of the thing is that the user community points out the problem and the use case. And then we try to solve the use case using international standards or IHE profiles. So that's why I have
all the countries are now, they have programs about interoperability. And in each country, they are inventing the wheel. And we have to emphasize that there is a lot of experience inside IHE International. And together as a community, we have a lot of experience. So country, if you want to start a project, don't try to solve the problem yourself. It will cost you at the end much more effort than when you use IHE experience. So profiles, not only profiles, but also how to combine all profiles. And also the methodology of IHE, it's ISO certificated, is important. It's not only profiles, it's also a methodology.
Yes, indeed. Because the profile are mainly intended for the vendor. But you are from the user community, Evert. I think there is a challenge for us how to better engage our user community, because the issues we want, it's for whatever thing for IT. You want to solve a problem for the user, and the user here is the care community, the care providers. How can we engage more the user community? And please, if you're from the user community, speak up. You can unmute yourself. Yeah.
Well, we all know that's difficult to get users involved. On the other hand, I represent the Dutch Society of Radiology. Well, there aren't many radiologists, so if one person is active in interoperability, it can be very powerful. But there are some articles. The American College of Cardiology has written an article, I think it's about 216, but also on the radiology side, there are really good articles about how to reach interoperability and what is the importance of IHE. So getting the users involved, yes, it's in a way difficult. On the other hand, the societies are they have written really good articles about how to reach interoperability. So yeah, the other hand is what T pointed out. When I try to get interoperability in my region, it's difficult to get everybody involved in the right way, and it takes a lot of time. And that's why we, as IHE Netherlands said, it's more important to get the government involved, because if the government gives advice about guides, how to implement or how to reach interoperability, the board of directors of my hospital will listen to that more than when I, as an individual or as IHE user chair, says this is the way to get interoperability. So national programs are important, and what T mentioned was the so-called ZIN. I don't know how you translated that, T. But
National Healthcare Institute.
We, as a radiologist, I have to solve problems. There are guidelines how to solve problems, but all these guidelines are on paper, and that's, well, in these times useless. I need guidelines that are that guide me electronically, and computers, well, on paper you can interpret the guideline with your own handwriting, but computers want one solution for the whole country, otherwise it won't work. So, and that translation has to be made. So the national society of medical doctors, and they have to realize that they have to write down their guidelines in a way that computers can deal with it, and that's difficult for them. And perhaps that National Institute of implementing guidelines, we need those kinds of things, and those institutes will realize the importance of IC profiles, because only using standards is not enough. You have to write down thoroughly how the information gets from one point to the other, to the other, to the other. And well, then you get all these issues we all know about. The language you use, you have to decide every step and make a decision how to use or how to implement that part of information. So it's getting users involved. Well, you have a lot of medical doctors who are active in e-health, but if we all do it different, you won't reach anything. So you have to help them to do it uniform. And that's something that we are as doctors, well, it's difficult to realize that kind of uniformity, and we need other layers to realize that. Perhaps,
yeah. Can I add, T, here? I think what will help is that users understand that interoperability is also their responsibility. And what you see most often, that when it's on their plate, they tell to IT, I don't know what to decide, you decide. And IT is really deciding because, yeah, the users are not, they are not taking responsibility. So we have to decide. And with the upcoming information paragraph on the Healthcare Institute, that's an important one, because now it's on their plate. explicitly, and it will be monitored by an official stakeholder. That's a very important one. I think it's maybe interested that I will translate that information paragraph that will be demanded of the users. So if we could have this in a bigger scope internationally, I think that the user community will understand, hey, interoperability is our cup of tea. We have to act.
Thank you, Evert and T. I think it's very interesting points and critical points indeed. Being part of a national program, uniformity, and also indeed responsibility, because the user, you can have the best tools and frameworks and platforms, but there is some responsibility as well. Great. So there was also in the poll, we saw that the first question was also on exchange experience between the national initiatives. And a lot of people pointed this out. I find this to be a small issue as well, because so often, yeah, I go to Switzerland or another website, and then it's in German or in another language, which I unfortunately do not understand that well. Is there a need for a kind of chat Slack platform, an interactive platform, or should we only need kind of a more static web page? Anyone having some input to how we could improve this?
Yes, T, I would promote an interactive platform.
Yeah, I think in the times that we are living in right now, I think we will have to work on it. I have a final question for you, IHE-Europe. How do you know it? And do you follow the activities? Are you up to date or not? If you could so it's the same URL, wooklab/IHE-EU. And I would say don't hesitate to reach out to us. If you think further on it, just drop an email, and let's hope that we'll have an interactive platform where we can reach out more easy to each other and share experiences. Andreas, is there anything that you would like to share from a point of view of Germany, or on an other point of view? Because time is ticking, and
yeah, exactly. Well, maybe not from Germany, because I'm not directly involved in IHE Germany, but as a current IHE-Europe co-chair, of course, it's very vital for us that we serve, especially also the national initiatives throughout Europe. So it's important for us to know this, what your needs are, and how IHE-Europe can support you. And the other aspect, which was also briefly touched already, is especially also on IHE-Europe level, we have a little bit of challenge holding up this community of users and vendors, mainly participation of the user side. So if you have ideas on how we can improve this or make it more attractive for the user side to also engage on the IHE-Europe level, this would be very helpful for us. And with that, Karlien, switching back to my moderator role, we are getting close to the end of the session, top of the hour.
Yes, so, and I would invite you to join us for our other sessions. We still have interesting sessions today. You can join VIP tours to the Connectant floor at lunchtime and at the end of the day. But there are other sessions. You can still register for each of the sessions this afternoon, tomorrow, and on Thursday. We hope to welcome you in another session or to one of our group meetings. And thank you very much for your collaboration today.
Exactly. There will be now a lunch break until 1 p.m. And the next session is then about a new offering from IHE, the IHE Sharer Zone, which is especially interesting for vendors to participate, but it might also be interesting for user side to get some knowledge about that and then ask the vendors if they are engaging in this. And yeah, for sure we will think about how to continue a format where the national initiatives can engage more among them. So hopefully see you then in an upcoming IHE experience session. Until later.
Thank you.